When the alarm clock goes off in the morning, no one that I've ever met wakes up and says, "Oh, can't wait to go to work and be engaged today." Employee engagement is one of the 20 most hated leadership words, according to account temps. When we talk about employee engagement to employees, what do they think we're trying to do? Get more out of them. They think it's management code for higher productivity, better quality, better patient satisfaction, all of the lists that you all just came up with. And that's not always very motivating for them. So let me ask you another question. What are the benefits to the frontline staff themselves, to them personally, when they are engaged at work? Feel free to raise your hands and our microphone runners will come around. You might think about this for you personally. What are the benefits you feel when you're engaged? Yes. Okay, so they work smarter, not harder. Awesome example. So it makes my day go easier, right? It's easier. What else? What are other benefits? Pardon me? Yeah, they feel part of the team. They might feel included. You know, that psychophysiological arousal feeling you get, you know, when you're part of a successful team.
They enjoy what they're doing.
They enjoy what they're doing. And the benefit of enjoying what you're doing is less stress. You have fun. You're happier. You might sleep better at night. You might get sick less often. There's a whole host of physical and psychological benefits. But we don't always talk about those, do we? When you get that employee engagement survey back and you're looking at what the results are, we don't always get people to focus on why it would benefit them personally if they connected more to what makes them feel engaged. And I think we're missing the mark there. Now, according to Modern Survey, Don McPherson, the president of Modern Survey, is very generous and shares healthcare-specific data with me from their national database. These are the top 6 drivers of engagement. Clear values known and understood. Do you think in your organization people know the clear values? I was surrounded by them before when I was up here practicing, right? Yeah, don't you think your folks know RICE? You know the reverence, integrity, compassion, excellence? Yes? Yeah. I think working for a mission-driven organization like you do, you have a better shot of that than many that have different drivers. Then we've got a commitment to patient service. This is one that shows up specifically on the healthcare list, doesn't show up on a main list, not even commitment to customer service shows up on a general business list. So obviously this is important, why people want to work in healthcare. Senior management interested in employee well-being. It's always interesting to me. I will ask team members the question, how do you know the senior management is interested in your well-being? And do you know who they think of as senior management? Anyone above their boss. So if I'm a nurse and I have a nurse manager, the director and above might be senior management. If I work in EVS and I have a supervisor, maybe I work the night shift, you know, anyone who's that supervisor's boss. So we can't just push the responsibility off to who you might perceive of as senior management, because I'm guessing for most people, you are senior management. They perceive of you in that light. A feeling of personal accomplishment that goes right along with Dr. Burns' definition of engagement. Boy, do we have an opportunity there. I mean, if you can't feel personal accomplishment working in a hospital or a health system, I don't know where you can find it. Number 2 is they can grow and develop at work. This doesn't mean going out of town to conferences or tuition reimbursement. This means the everyday kind of growth and development that I know is happening all the time. And finally, confidence in the organization's future. Now, I know from the over 100 of you that responded to my survey, and I did multiple telephone calls, people are wondering what is happening with the organization's future. There's a little stress around the not knowing, which is spectacular because you're getting more information today. You've already gotten a lot of good information. You're going to get those communication pointers tomorrow that Sandy was talking about earlier. And the more you can communicate those, the more you can help grow the confidence in the organization's future. The other thing that's interesting is maybe you're wondering about the organization's future, not maybe from a confidence perspective, but just in general. And so that's something that's important for you to think about for your own engagement.